Hello and welcome. Today, we are stepping right to the edge of what's medically possible. We're talking about treating a patient before they are even born. It's a truly incredible subject. And I want to start by saying this entire explainer is presented with the utmost respect for the pioneering work of Professor Alireza Shemsherzad, a world-renowned fetal surgeon. It's also based on a profound review by Dr. Reza Lankarani, a general surgeon and the founder of the Surgical Pioneering newsletter. We're going to explore a procedure that is, without a doubt, a new frontier in surgery. All right, so here's our roadmap. First, we'll get to grips with the life-threatening condition we're dealing with. Then, we'll look at the incredible idea of intervening in utero. After that, we are going inside the procedure itself. We'll then unpack the results, the hope, and the risks. And finally, we'll zoom out and look at what this all means for the future. Let's get into it. So, first things first, what is the actual problem that doctors are facing here? It's a condition that's as rare as it is dangerous, called a Vein of Galen malformation. Now, it's really important to note this is not a tumor or some kind of growth. The best way to think about it is like a critical plumbing issue deep inside a developing baby's brain. You've got arteries that are supposed to carry high-pressure blood, but instead of feeding into smaller vessels, they're dumping directly into veins. This creates this intense high-flow shortcut that puts an unbelievable amount of strain on the tiny fetal heart, often leading to heart failure and brain damage, sometimes before the baby even takes its first breath. And when we talk about the stakes, they honestly could not be higher. For the most severe, high-risk cases of this condition, with the standard care that's been available up until now, the expected mortality rate is 90%. Just let that sink in. That's a truly devastating number for any parent to face. And even for the very, very few who do survive, the outlook is incredibly tough. Only about 9% of these babies are expected to hit their normal neurodevelopmental milestones by 6 months. The other 91%, they face significant challenges. So it was painfully clear that for these severe cases, the existing approach just wasn't enough. Something radically different was needed. And that leads us to this massive shift in thinking, the in utero intervention. A team of brilliant doctors basically said, if we can't win this fight after birth, what if we could change the battlefield completely? They asked this really fundamental question. It almost sounds like science fiction, right? Instead of waiting for a baby to be born critically ill and then trying to fix the problem, what if you could intervene while they're still in the womb, go right to the source, and give that tiny heart and brain a real fighting chance to develop normally? The goal they came up with was a procedure called in utero embolization. So what does that mean? Well, essentially, it's a minimally invasive surgery where they go into the fetal brain to block off that dangerous high-flow connection. The idea is to reduce the pressure and let the baby's development get back on a healthier track. And please make no mistake about it, this is not a one-person job. It takes an entire orchestra of specialists. You've got maternal fetal medicine experts, a neurointerventionalist, a pediatric neurosurgeon, fetal cardiologists. I mean, the list just goes on and on. It is an absolutely incredible feat of collaboration just to get all of that expertise in the same room working together. Okay, so let's pull back the curtain. How is a procedure this delicate actually done? Welcome to Section 3, where we go inside this fetal procedure. It is a multi-stage, highly choreographed surgical feat. It all starts with incredibly detailed planning, using MRI and ultrasound to map the exact target. Then both the mother and the fetus receive anesthesia. And then comes the truly mind-blowing part. Using ultrasound as their eyes, the surgeons guide a needle through the mother's abdomen, through the uterine wall, and into the fetal skull. From there, they have to navigate a tiny little catheter to the malformation, deploy these platinum coils to block the flow, and then, of course, begin intensive monitoring. The tools they use for this are a complete marvel of engineering. We're talking about an 18-gauge needle just to get access, and then an impossibly thin and flexible microcatheter and microwire to navigate these tiny, delicate fetal blood vessels. And finally, these tiny little platinum coils that basically act like a microscopic plug to fix that dangerous leak. So the procedure itself is incredible to think about. But did it actually work? Section 4 gets to the heart of the matter, the results from the clinical trial. And let me tell you, it's a story of both incredible hope and very significant risk. Okay, this is the slide that could just take your breath away. Remember that grim 9% figure for survivors meeting their milestones with standard care? Well, in this study, for the babies who had the procedure and survived, 100% of them were meeting their neurodevelopmental milestones. That is a simply astounding, game-changing difference. So how did they know it was making a difference, like right then and there? Well, they used fetal echocardiography, and they saw that on average, the procedure immediately reduced the cardiac output, that's how hard the fetal heart was working, by over 33%. This was a direct, measurable sign that the strain on that little heart was being relieved, right there on the operating table. But, and this is absolutely critical to understand, the procedure comes with a major trade-off. It's not a silver bullet. While it has this incredible potential to dramatically reduce mortality, brain injury, and developmental delays, it also significantly increases the risk of causing an unscheduled and often preterm delivery. It's an incredibly delicate balance of risks and rewards that families and their doctors have to navigate together. So this all brings us to our final section. What does this all mean for the bigger picture? We are truly, genuinely looking at a brand new frontier in surgery. The main conclusion from the study, which was published in JAMA, is cautious, as you'd expect, but it's crystal clear. These early results prove that this complex, almost futuristic-sounding procedure is, in fact, feasible. It can be done. And that single fact opens a door that was, for all of history, completely closed. And that just leaves us with this profound question for the future, doesn't it? I mean, if we can now safely enter the fetal brain to repair blood vessels, what comes next? What other genetic disorders or congenital conditions might one day be treated not in the nursery, but in the womb itself? And so we'll end where we began, by extending our utmost respect to the teams who are pushing these boundaries every single day, especially to Professor Alireza Shemshezaz and to Dr. Reza Lankarni, whose incredible work formed the entire basis for this explainer. Their efforts are literally creating a new surgical frontier. Now, if you want to dive deeper into this fascinating topic, and I really hope you do, you can read the original study on the JAMA network, and you can find that detailed review at surgicalpioneer.co-adx.me. Thank you so much for joining us.